Medical Coding Test Prep Practice Exam and Study Guide, 25 Most Common Questions. Question 1. Which modifier is used to indicate a bilateral procedure? -50, -51, -59, -25. Modifier -50 is used to report bilateral procedures performed during the same operative session. Question 2. What does ICD-10-CM stand for? International Classification of Diseases, 10th Revision, Coding Management. International Classification of Diseases, 10th Revision, Clinical Modification. Internal Coding of Diseases, 10th Revision, Clinical Manual. International Code of Diagnosis, 10th Revision, Clinical Management. ICD-10-CM stands for International Classification of Diseases, 10th Revision, Clinical Modification. Question 3. In CPT coding, the global period refers to the duration of the surgery, the time from admission to discharge, preoperative, intraoperative, and postoperative care included in a code, the lifetime of the patient. The global surgical package includes all services normally furnished by a surgeon before, during, and after a procedure. Question 4. Which of the following is a HCPCS Level II code? 99213, 00100, E0143, 45378. HCPCS Level II codes start with a letter, AV, and represent supplies, equipment, and drugs. E0143 is for a walker. Question 5. Which coding system is used to report outpatient hospital procedures? ICD-10-PCS, CPT by ICD-11, MSDRG. CPT, current procedural terminology, is the standard for reporting procedures in outpatient and physician office settings. Question 6. An established patient is one who has received professional services from the physician within the past 1 year, 2 years, 3 years, 5 years. An established patient is one who has received professional services from the physician or another physician of the same specialty in the same group within the last 3 years. Question 7. Which ICD-10-CM code is used for a routine checkup, well visit? A code, Z code, S code, V code. Z codes are used for factors influencing health status and contact with health services, including routine exams. Question 8. Which symbol in CPT indicates a new code? Plus sign, plus, bullet, triangle, star, asterisk. A bullet symbol, placed to the left of the code number, identifies a new code. Question 9. What does the X placeholder in ICD-10-CM serve? To indicate an unknown diagnosis, to allow for future expansion of the code, to mark the end of the code, to indicate an experimental procedure. The X placeholder is used in certain codes to allow for future expansion and to maintain the 6th or 7th character position. Question 10. Which section of CPT would you find the code for an appendectomy? Evaluation and management, radiology, surgery, medicine. An appendectomy is a surgical procedure and is found in the surgery section, digestive system. Question 11. Medical necessity is defined as the cheapest treatment available, services that are reasonable and necessary for the diagnosis or treatment of illness, whatever the patient requests, any service provided in a hospital. Medical necessity refers to healthcare services that a prudent physician would provide to a patient for the purpose of preventing, evaluating, diagnosing, or treating an illness. Question 12. A bundled code is one that includes multiple procedures in a single code, is only used for group therapy, requires 2 different coders, is used for pediatric cases only. Bundling refers to using a single code to report a group of related procedures or services. Question 13. The main term for acute viral hepatitis in the ICD-10-CM index is acute viral hepatitis infection. In the ICD-10-CM index, you look up the condition, hepatitis, first, then the modifiers, acute, viral. Question 14. What is the purpose of the CPT modifier -25? Significant, separately identifiable E/M service by the same physician on the same day. Discontinued procedure. Multiple procedures. Professional component only. Modifier -25 is used to report an E/M service that was distinct and separate from a procedure performed on the same day. Question 15. CPT codes are updated by which organization? CMS, AMA, WHO, AAPC. The American Medical Association, AMA, maintains and updates the current procedural terminology, CPT, code set. Question 16. Which ICD-10-CM chapter covers diseases of the circulatory system? Chapter 1, Chapter 9, Chapter 15, Chapter 20. Chapter 9, codes I00 I99, covers diseases of the circulatory system. Question 17. In the CPT manual, codes for anesthesia are found in the range 00100-01999, 10,021 to 69,990, 70,010 to 79,999, 99,202 to 99,499. The anesthesia section of CPT uses codes in the 00100 to 01999 range. Question 18. What is a sequela in ICD-10-CM? The acute phase of a disease, a complication occurring during surgery, a late effect or condition produced after the acute phase of an illness has ended, a hereditary condition. A sequela is the residual effect, condition produced, after the acute phase of an illness or injury has terminated. Question 19. Which of the following is not a component of history in E/M coding? Chief complaint, review of systems, physical examination, past, family, and social history. Physical examination is a separate key component from history in E/M coding guidelines. Question 20. The term upcoding refers to using a code that represents a higher level of service than actually performed, coding for a service that was not provided, using the most specific ICD-10 code, billing the patient directly. Upcoding is the illegal practice of submitting a code for a more expensive service than the one actually provided to increase reimbursement.